we say, and we're agreeing at this table, that the vaccination is the best way to reduce transmission and eliminate the virus. Masks are secondary because it will obviously be help. But if you had your choice, you would go, we'd love you to be vaccinated
And
wear a mask. But in the long run, if the vaccinations work, masks would be eliminated, theoretically.
Eventually, yes.
In the long run,
Eventually.
Yes.
that's right.
Eventually.
Absolutely.
But in that process, people are going, well, I want to get pregnant. Or I'm worried about the fertility of my daughter. And you're telling us through the research that that's not a risk or a side effect that has been high enough or existent to keep you from getting it, correct?
There is no evidence
Right.
at all.
Zero.
Zero evidence. And we're, everybody's looking for it. We want to have evidence. If it's there, we want to know. There's no evidence available that shows any effect on fertility of these vaccines at all.
And in fact, our local fertility specialists and our local OBGYNs have come out and all over their social media to their patients, they're saying, take the shot. They're encouraging their patients to get vaccinated because we are seeing young, healthy women pregnant on the ventilator. We have one cannulated for ECMO, which is where they bypass their lungs and oxygenate for them. Pregnant in their 20s, now with a very seriously life-threatening disease.
Right.
And it's life-threatening to their child as well. We, like I said earlier, we had an infant, a newborn, born with COVID. We haven't seen that here much in the past. So we don't want to start seeing that now.
Sure.
So the more we vaccinate, and their doctors are coming out and saying, please take the shot.
I don't know an OB in this area that is not saying, go get vaccinated, go get vaccinated. My daughter was, I think she was 20 weeks pregnant, and I kind of forced her to get vaccinated. And just the other day, someone exactly like her, 2 other kids, 3rd pregnancy, passed away from COVID.
And that's the
And
thing, Keith. We don't know who it is.
That's preventable.
It is
so
preventable.
It was
It's
so
100%
preventable. It was so preventable. And I don't know. People are worried about the vaccine and all this. Okay, so there's a risk. Like we talked earlier, heroes are not people that save themselves from a fire. If you're looking at a burning building and people are screaming, the heroes are the ones that run in and try to help save people. You taking the vaccine, you're helping your fellow man, not only yourself, your family, your neighbor, someone at the grocery store, but you're a hero. I think anyone that takes a vaccine is a hero. Sure, there's a risk. Sure, there's doubt. But you know what? We don't do anything without that.
Sure.
And we're not going to gain anything unless we take that risk and have some faith that, people are not doing this for any gain other
And I
than
think
to
that's where
keep you healthy.
There is a trust level that. That's
Yeah.
why I wanted to have. I've known Keith the longest. Obviously, for the record, how long you been doing this, Dr. V?
20 years.
Okay. How long you been doing this, Mark?
20 years.
20 years.
30, jeez.
So this is what I tell everybody. This is my.
Now, I've been a doctor for 30 years.
Yeah.
I've been doing public health for 20, so we're good.
Yeah, you're in the. So here's why I tell them is like, when a mechanic or a friend who is not in that industry tries to tell me what they know, I said it is comical, because if I have friends in all kinds of industry, it would be like me telling you how to do your industry. Where that's why I'm just thank you for being patient with our ignorance. Thank you for being patient with the people that are not understanding it. But it really matters because your investment of your life matters to sit at this table and help us